So welcome, everybody, to today's webinar, the Youth Thrive Survey, Measuring and Advancing Well-Being for Youth and Young Adults. My name is Lisa Mishraki. I am a Senior Associate at the Center for the Study of Social Policy and will be facilitating the webinar. It is my great pleasure to welcome you all. During the webinar, we invite you to connect with each other and share ideas. Our presentation will begin in just a moment, but first, some important reminders. The webinar is being recorded and will be available after the presentation. Due to the number of people online, all attendees are in listen-only mode. You can type questions at any time using the chat or question feature in your control panel. To signal to us that you want to ask a question, click on the hand icon in your control panel and we will unmute you. The purpose of today's webinar is to provide you with a brief overview of the Youth Thrive framework and to go over and discuss the Youth Thrive survey. We really want to focus the bulk of our time hearing from early adopters of the survey and learning from them about their implementation process and their findings. We also want to provide you all with the opportunity to ask questions and exchange ideas with other jurisdictions who are exploring implementation of the survey. I am joined today by a great group of presenters representing public systems and nonprofit organizations across the U.S. working with youth and young adults. And these are really experts in the field that have a lot of experience. So I'm not going to read their individual bios, but I'm just, you could see their pictures, and I'm just going to briefly introduce them, and we will hear from them later in the presentation. So we have Jaime Munoz from Orange County, California Social Services, Kai Ramirez from Seneca Family of Agencies, Nancy Mason from the Muskogee Nation Youth Services in Oklahoma, Shelly Flynn Harding from Epworth Children and Family Services in Missouri, Allison from Multicultural Community Services in New Jersey, and Nisha from Georgia Division of Family and Children Services. Welcome to the presenters, and thank you for joining us today. So what is the Youth Thrive framework? What is Youth Thrive? It is the name of both a research-informed framework that identifies protective and promotive factors that are shown to enhance well-being and healthy development in all youth, and it's also a name of CSSP's national initiative that is helping public child welfare systems and juvenile justice systems to use that research to help improve their policies, their practices, so that they are more aligned with what the research tells us young people need in order to succeed and thrive. Youth Thrive is an approach, not a model or an intervention, and it can inform any program or any work that is in support of youth and young adults. To launch the Youth Thrive framework, we examined the research on positive youth development, resiliency theory, the research on adolescent brain development, and the impact of trauma. And we developed the theory of change that you see based on that research synthesis. It depicts the interaction of risks, protective and promotive factors, and indicators of healthy adolescent development and well-being. In other words, the stronger the protective and promotive factors, which you see in the lower left-hand side, hopefully I got that right on your screen, the lower the risk and the greater the likelihood that youth will experience the indicators of healthy development. And just in case it's not clear, I'll read out loud what the 5 protective and promotive factors are. And that is, again, in that lower left-hand circle. They are resilience, social connections, knowledge of youth development, concrete supports in times of need, and social, emotional, and cognitive competence. So after we developed the framework and worked with several jurisdictions around the country to see how it can inform their policy and practice, then came the question, well, how do we measure that? How do we know if in fact their young people have these protective and promotive factors present in their life, and how do we know if there's been any growth in any of these protective and promotive factors? And so to address this challenge, we partnered with Metis Associates and worked together to develop a high-quality, validated, and reliable survey that assesses these 5 protective and promotive factors. So the Youth Thrive survey is a youth self-report instrument. And again, it measures the presence, the strength, and the growth of the Youth Thrive protective and promotive factors. It can be used by any organization, any individual, or any system working with youth and young adults. It's designed for youth and young adults ages 12 to 26, and it is publicly available free of charge. I'm going to say that one more time because we've received several inquiries about whether or not there are any costs associated with the survey, and so I'm happy to say that it is publicly available free of charge. The survey is composed of 5 sections, one for each of the 5 protective and promotive factors. Using a Likert-type scale, respondents indicate the extent to which each statement describes them, and it focuses on characteristics and competencies that measure that protective and promotive factor. It also includes 11 demographic questions, and these questions enable organizations and workers to understand the characteristics of the youth and the young adults, and also allows for the disaggregation of data by subgroups. It takes most young people less than 15 minutes to complete the survey, and it requires minimal training to be able to administer the survey. And available on our website, which I will show you shortly, there is a user guide. What is most exciting and unique about the Youth Thrive survey is that it measures positive constructs and can be used in a variety of different ways. It can be used as an assessment tool to identify strengths and areas that need strengthening in order to inform case planning with youth and young adults. The data can be rolled up for program evaluation purposes to measure the effectiveness of interventions or other services for youth and young adults. And it could also be used as a continuous quality improvement tool to measure and monitor progress and inform policy and practice decisions. So how did we get here? The development of the Youth Thrive survey was very much a co-designed process with youth and young adults. We started by asking them what thriving meant to them, what it looked like for them, and then began creating an exhaustive list of inventory items for each one of the protective and promotive factors. We drew from already validated instruments and developed new items where there were gaps. Once we had a preliminary set of items, we conducted focus groups with different groups of young people to get their feedback on that initial list. We held focus groups with young people from an LGBTQ community center, a group home, a church youth group, and a community services center. We refined the survey based on their feedback, and they provided a lot of really good feedback, particularly around the language that we were using. And then we conducted cognitive interviews. We refined the survey again based on what we learned from the young people, and then moved into field testing. We conducted 2 rounds of field testing. In the first round, we had approximately 400 respondents, and in the second round, we had about 230. Over the course of the testing, we landed on an instrument that consisted of the final 66 items. We then automated, turned the instrument into a web-based survey with built-in reports, which I will go over shortly. And then we launched the survey in November of 2018. I just want to share with you, for those of you who are not familiar with the framework and or the survey, I just wanted to give you a sense of what you're likely to see. So in the top green in the top green section, you will see the definition of resilience, followed by the items, and these are sample items that are in the survey, and the constructs that each one of those items measures. So for resilience, some of the constructs that the survey measures are things like optimism, problem-solving skills, and persistence. For social connections, some of the constructs are spiritual connectedness, family social support, and constructive community engagement. And for knowledge of adolescent development, some of those constructs are identity, self-esteem, and values. The survey can be accessed through our website. And I would like to share with you, and this is on the page that you would go to be able to access it. So I just want to share with you a couple of things. You will see that there is a link for a one-pager that describes the survey, and that's something that can be shared with coworkers or staff who are interested in implementing it. And then there is the user manual, and there is a new tool that we've recently developed that I would like to show you, which is a tip sheet for workers. And this was something that was developed in response to requests from the field, because there were several questions that were being asked about, well, how does this survey support me in my work? What are the best practices for me supporting young people? How do I talk about the results with them? And so those are things that you will find in the tip sheet. We wanted to make sure that we created a survey and a data system that was as flexible as possible so that it could meet a variety of different needs. And so we created it with multiple levels of access to the data, commensurate with the user's role in their organization. So there are, therefore, 4 levels of access. So a direct service worker has access to the survey data for young people on their caseload. At the organizational level, an administrator would have access for data for all the young people that are served by that organization. And at that state level, it would be access to data for all young people across the state. And CSSP would has access to all the survey data, but it's important to note that it's not individual level data, it is only aggregate level data. And another thing that is really important to note is that all of the data in the survey that is collected is de-identified, so that confidentiality is maintained. And we provide guidance on how to manage the data and how to maintain confidentiality in the user manual, which can be found on our website. So as I mentioned earlier, there are an array of reports that are available to you that can be used to inform policy and practice decisions. And so you can have a report that tells you gives you a summary of all of the surveys that have been completed and gives you a summary of all the scores. And then there's the individual report that provides individual scores over time for each young person. And this would show their average scores for each factor, as well as an overall score. This is really helpful in identifying where a young person may be particularly strong, as well as which areas they might need extra support. And it also might be helpful to look at their responses to specific items to identify if there are patterns. For example, if there is one item where they're specifically saying, this is not at all like me, and that could help inform ongoing conversations with that young person, as well as to inform case planning with that young person. there's also available to you is a report that compares scores from pre and post. So that can be used as an evaluation tool to help you assess whether or not there's been any change in protective or promotive factors for young people after they've received an intervention or there's been a change in policy or practice. And then the cross-demographic analysis report, that's my favorite report because it allows you to look at the data in a variety of different ways and be able to zero in on a very specific segment of the young people that you serve. And so you can slice and dice the data based on the demographic characteristics to give you further insight into how a specific group of young people are doing. And so you can look at the data according to gender identity, to race and ethnicity, in foster care, out of foster care, living, where they're currently living, and age range. So it's a really great report. And then finally, you have the data download. So the raw data is yours. You can use it to answer any question that you have to help inform your policy and practice decisions. It's one thing I just want to note in terms of looking at the data and looking at the results of the survey is that the survey scores, they're averages. So they're meant to give a sense of where young people are at that point in time. But, we all know that this one source of information cannot tell us. It's just one tiny piece of how that young person is doing in general. And it's really meant to prompt conversation and to prompt further exploration to be able to identify patterns or themes as it relates to young people that you're working with. So it's just really important to review the survey results in the context of other information about what that youth may be experiencing at that point in time. So as I mentioned, we launched a survey in November of 2018. And to date, as you will see on the map highlighted in green, there are 193 users across 40 states. And the users represent a wide array of child welfare systems, juvenile justice, departments of health. There are some school systems, as well as private organizations such as the YMCA and Boys and Girls Club and other nonprofit organizations. To date, we have 360 completed surveys. So there are folks that have registered and are currently working through thinking about what are the best ways to administer the survey. And I think I want to note that one of our future goals is to be able to norm the survey so that the scores can be more meaningful and can be comparable. But for us to be able to do that, we need a larger data set to be able to do that. So I'm going to stop because I know I just shared a lot of information very, very quickly. I'm going to pause and see if there are any questions about the information that I just shared. And you can feel free to raise your hand if you want to ask your question, or type it in using the question or chat feature. So there's one question about whether or not the slides will be shared. And yes, we will send the slides along with the recording. Okay, and I see Rachel Barth has her hand raised, so I'm going to unmute you. Rachel, go ahead, you're now muted. Okay. Tracy Heisler, you are now unmuted. So some of you have self-muted. Okay, Tracy's question is, Have any CASA programs used the survey? That's a great question. What I can tell you is that there have been CASA programs that have registered to use the survey, but that is as far as I know based on the data that we've received. I haven't yet seen any completed surveys, but there are definitely some that have registered to use it. And there's a question from Susan Wilson about how can she connect with other survey users that are in her state, and that is a great question because one of the reports that is available to you is provides you with all of the other organizations in your state that have registered to use the survey. So it's a registered users report, and so you'll have a sense of both who's using the survey nationally as well as who's using it within your state. And that could be really helpful in avoiding duplication of effort or coordinating services for other agencies that are in the state. So it's a great question. All right. Tracy, I'm going to try to unmute you and see if that works. I think you're still self-muted, but feel free to type in your question and I will read it out loud. All right. So that seems to be all the questions for now. We will have an opportunity later on for peer exchange and asking additional questions. All right, what we'd like to do now is we would like for you all to take a poll. So just give us 1 second as we launch the poll. So hopefully you can see the poll on your screen. Okay. So the question is, just for those of you who may not be able to see it, is how do you envision using the Youth Thrive survey? And the options are to inform case planning with youth and young adults, to evaluate the effectiveness of programs and practices as part of ongoing continuous quality improvement efforts, or all of the above. And we'll just give folks about 30 more seconds. I see that about 70% of you have voted already. So 30 more seconds so that we can get as close to 100%. Okay, so here are results. So, which is great news. About 63% of those who voted said all of the above. So it's really great. And I think the next piece of our presentation is going to really be informative as we hear from 5 of our presenters of how they've begun to implement the survey, and they're using it for some of those areas. And so I think that will be really helpful hearing from them and learning from their findings so far. And so we're going to start with Jaime and Kai from Orange County Social Services and Seneca Family Services. And they're going to talk a little bit about their programs as well as how they've implemented the survey and some of their lessons learned. Right. All right. Jaime, you are now unmuted, and Kai, you are also now unmuted. Jaime and Kai, you are both now unmuted.
Okay, great. So my name is Kai Ramirez. I'm the program supervisor for family finding in Orange County for Seneca. Our program is generally referred for youth that are very disconnected. Most of them have been recently removed from their homes, experienced quite a good deal of trauma. Most of our kiddos are at an emergency shelter or in a group home setting, and generally don't have the information about their family, or it's got lost along the way, but they're pretty disconnected when we're referred. So our job is to not only find those family members or those important people that were part of their life previously, to reconnect and form those relationships, but also to engage them and build those lifelong connections so that those kiddos are more supported. So we launched this survey a few months back and did it with the initial 6 referrals that came in that were of the age range for this survey, as we do serve ages 0 to 24. And what we discovered was that a lot of our kids, when they're referred, as they're coming in, their trauma is pretty raw, and they're very aware that they are disconnected from important people. And administering this survey in those types of crisis situations for them, they weren't very responsive. A lot of them, so 4 of the 6 that were in the emergency shelter or group home setting escalated very quickly, refused to complete the survey, and it required some interventions by my family finders to de-escalate them. The 2 that did complete the survey, those 2 young ladies were both in adoptive homes that they've been in for quite some time. So they had the support and they were able to work through the survey with the family finder. So we discovered that for our kiddos that are experiencing very raw trauma and crisis, the timing of the survey is very important. So we are looking at now doing a retrospective pre and post survey. So at the end of services, when our kiddos are more connected and feel more supported, having them take the survey twice, one time as a pre-test, so having them reflect back on where they were when services opened, and then as a post as to where they are now that services are closing. We also found that reordering the sections was helpful for us. We thought that ending with the youth resilience section would be a more positive way to end, as currently the last section is the cognitive and social emotional competence, and the last statement says, I am sad most of the time. And so for kiddos that, we're experiencing such great trauma and being so disconnected, ending on that note seemed a little tough. So we switched the order around, and we end with the youth resilience section to end on a note where it's like talking about how they've gotten through these struggles and how they can look to the future and know that things will get better.
Great, thank you, Kai.
You're welcome.
And I'm hoping, Jaime seems to still be self-muted. Do you think that you can talk to this next piece?
Yes, I will do my best. So Jaime is the program manager for our older youth, so that 18 to 21 age range. And so his hope is to use the survey to help inform the development of that population's independent living plans. So as our kiddos are hitting that 14 to 16 age range, that they would start to implement the survey to help inform their plans moving forward as they get near adulthood. So they recognize that some survey items address essential domains for successful transition to adulthood, so they think it would be applicable for children as they're learning to do those independent living skills. And the hope is that eventually it would be used statewide as a way to inform the plans.
Thanks, Kai. And I just want to add that I've been working with Jaime around this, and I think this could be a useful tool for other systems or organizations that are interested in looking at this as a tool to inform case planning or independent living services I think one of the things that was helpful is crosswalking the items and the constructs that are in the Youth Thrive survey with what is being measured in the existing assessment tools. It's really helpful to identify where there's some alignment, as well as identify gaps that the survey is able to fill. And so that's one of the things that we did together in support of the efforts for approval for its use. And Jaime, as soon as you're able to jump on, there'll be an opportunity for you to add additional information when you're able to address the audio.
Okay, can you hear me now?
Oh, perfect. Yay.
Yes. I'm sorry, it was taking a few punches to unmute. But thanks. A few thoughts about the two uses that we're considering for the instrument. In regards to family finding, so I'm talking from an administrator perspective with the Orange County Child Welfare Services Agency. We have about 2,500 youth in foster care. And so from family finding, we were looking at how do we evaluate the effectiveness of that intervention. And so our original thinking was, well, let's do a pre-post using the Youth Thrive survey with the assumption that the post-core should demonstrate an increase in connectedness. And so then Kai tried it out, and then that's where she shared the learnings that, yes, we could still use the instrument, but we needed to adapt it for the type of youth that were being referred to this service. And so I offer that just from a program development perspective that, this instrument does allow that flexibility. In regards to the other slide, which is about independent living, and so as across all jurisdictions with child welfare, youth 16 years of age and older are required to have a transitional independent living plan, that they are engaged in the development of this plan, and the plan is to support their successful transition to adulthood. And so when the Youth Thrive survey was announced, there were several aspects that immediately drew me to it from an administrator position. One, that it only takes 15 minutes to administer. The current instrument that we use is the KC Life Skills instrument, and it takes about an hour to administer. And that has implications for workload, but more importantly for youth engagement. The other aspect that was quite appealing was that it was free. There was no additional cost, and with all public entities, we're always under-resourced, so it's a challenge to try to identify funding for new resources that we may need, such as this one. And then the third aspect that immediately drew my attention was that it incorporated a data management system that we could use data for reports that were already built in, but we can also export the data for other kind of data analysis that we would want to do. So those were immediately attractive things. The next step then for us was that in California, we are required to use a nationally recognized instrument. The Youth Thrive survey, because it's new, hasn't been established as a nationally recognized instrument for California jurisdictions to use. So my intention is to advance that forward for it to be considered one of the approved instruments for the California jurisdictions. And so the first step was a crosswalk. The Transitional Independent Living Plan is supposed to support development of family, social supports, education, employment, housing, health, financial responsibility, and daily living skills. And from a first glance at the Youth Thrive survey, it seemed like it hit all of those. And so what I did with the Center for Study Social Policy was a crosswalk, comparing what California law absolutely requires. It requires that we hit 16 specific skills. We crosswalk that to the KC Life Skills, which has already been approved, and then the Youth Thrive survey. And what we found is that 15 of the 16 skills were hit by the Youth Thrive survey, making it a very promising tool to be used for this particular mandate that we have. And so I think those are like about the biggest hits. The other thing I'm hoping to do, so at one level, is inform the transitional independent living plan for the youth, optimize youth engagement between the caseworker and the youth and others. And then what I'd eventually like to do is to be able to monitor the domains to see which are areas that youth need more assistance with, so that then we can align our resource investments accordingly, such as maybe the caseworker's practice to be realigned to that, or maybe some of our contracted services that support those efforts. All right, thank you very much.
Thank you very much, Kai and Jaime. You mentioned a lot of great points. I just want to touch on a couple of the things that you said. One, in terms of what Kai mentioned, in terms of the timing and understanding what are the circumstances, what else is happening with a young person, and thinking about when is best to administer the survey. You know, as she mentioned, youth who are in crisis or who have just moved from being in crisis where things may still be fresh for them, you know, that may not be the best time to do this, as some of the items may be triggering. And also keeping in mind that for just youth and young adults in general, some of these items may be triggering for them. And so, you know, creating the most comfortable space and giving them opportunities to be able to process if they are triggered, and or, you know, obviously stop with the survey and come back another time. We offer a little bit of guidance in our user manual around this, and we will be developing more guidance on how to support young people, particularly paying close attention to if they are triggered, like what are the best practices for supporting them through that. But there is some guidance that you can find in the manual. A couple other things that I want to mention that have been coming up in terms, have been submitted as questions. One is that Jaime and Kai mentioned that they reordered the sections of the survey to end on a more positive note. And I want to say that that is completely fine in terms of the reordering of the sections, not so much the reordering of the sections is okay. Reordering of items within the section is okay. Any other change, well, I guess I should clarify it, but I mean is, okay, so if you're reordering the sections, it will still be a valid and reliable instrument. If you are reordering items within the sections, it will remain a valid and reliable instrument. However, if you make any other changes, such as, you know, shortening the survey, deleting some items, and sort of mixing things up, you're able to do that, but it will no longer be a valid and reliable instrument. If you are interested, for example, you really just want to focus on strengthening social connections for the youth and young adults that you're working with, and you only want to use that section, you can, and it will be valid and reliable if you're just using a section in its entirety. So you can use sections in their entirety and they will be valid and reliable, but the mixing and matching piece will no longer make the instrument valid. So I hope that that answers some of the questions that have been coming up in the chat. Another question that I want to address that has also come up, because there have been some concerns, you know, it's free now, how long is it going to remain free? Rest assured that it will remain free for quite some time, because the cost of maintaining the database is minimal. And we are the funder. CSSP is supporting the maintenance and the administrative fees that are connected to the database so that you're able to access the data and access the reports. And so there isn't any likelihood of disruption to that in the near future. And we received one other question that I'm going to address now before moving forward, about paper administration. And you are able to do that. The only thing is you will have to assign somebody to enter that data into the system, because, you know, that's how the reports are created and that's how you will have access to the data. And so paper administration, you know, is available. It's not preferred, but is available as long as you have somebody that can enter that data. All right, so there are some people who have raised their hands. I'll take a couple questions now, but we really want to wait for the peer exchange. So I'll just take one right now, and then if you can hold the rest for the peer exchange session. Digna Peralta, and I apologize if I am not saying your name correctly. You are now unmuted. Digna Peralta. Okay. Tracy, you are now unmuted. All right. So we'll hold, if you can hold those questions for the peer exchange session, we are going to move to our next presenter, who is Nancy Mason. Sorry, Nancy, we're about to unmute you. Okay, Nancy, you are self-muted, so if you can put in your PIN so that we can hear you. We're going to move on to the next presenter and then come back to you. So now we're going to hear from Shelly. Shelly, you are now. Shelly, can you hear us?
I can, yes. Can you hear me?
All right. Yes.
Great. Hi, thank you. Thank you, everybody, for being here today. My name is Shelly Flynn Harding, and I'm the Senior Quality Program Manager at Epworth Children and Family Services in St. Louis, Missouri. Our mission here is to help children, youth, and families move towards self-sufficiency by focusing on health, housing, education, and employment. Each year, we serve over 7,500 youth, children, youth, and families across the St. Louis region. We have a variety of services, including in-home family therapy, psychological testing, residential mental health treatment for youth, foster care case management and Chafee services, a youth drop-in center and street outreach for homeless youth, an emergency youth shelter, and 3 supportive housing programs for youth. So quite a lot of different types of programs. My role here is I work to ensure we are delivering our services with fidelity to our program models, meeting our outcome goals, and ensuring our work is in alignment with the latest research and best practices. And kind of part of that is just creating a culture of reflection and learning and data-driven decision-making. So we're constantly trying to make sure that we are testing out new approaches in the work that we're doing. So we were excited to be to start using the Youth Thrive survey, and we did a pilot that we began in March of 2019, and we are currently administering the survey to kind of look at our best practices for us for administering and interpreting the survey with 2 of our programs. The 2 programs that we chose to use, one is our Entrada program, which is our permanent supportive housing program for youth ages 19 to 24. So we had 10 youth who participated in this pilot. And then our residential treatment program, which is, we used one of our secure dorms. And so it's a mental health treatment program for youth, and we surveyed 5 youth ranging from the ages of 11 through 19. We also did do a mix of paper and web administration. So we had some concerns initially about whether or not using a web-based approach was going to work for all of our different populations. So we wanted to at least test it out first before we sort of made those assumptions. And so one of our programs initially administered the first survey through paper. And I'll talk a little bit more about what we kind of learned from that. And then, so one of the things that we did, sort of how we adapted the survey was we kind of compiled all of some key elements of the survey process into one document to provide for staff who were implementing the survey to try to, the user manual is fantastic. There's a lot of really great resources that are provided to implement and administer and interpret the survey. However, it was also something that we were trying to be as quick and simple and concise for staff who were going to be doing this among the thousands of other things that they're doing every day with our young people. So we consolidated that, and as part of that, we also developed something that was sort of a handout for youth that could, in their language, sort of talk about what the work that we were going to be doing with them. We also developed a survey tracker just as a way to manage the data and all the, the who's taking the survey, their client IDs, the dates of the survey, just as a way to begin tracking usernames and passwords, because at first that felt like that was going to be kind of overwhelming, but creating just sort of a tracker system that worked really well. And we had a survey implementation team, which consisted of myself and a few folks who were involved in each of those programs to sort of just talk about the survey, what it meant, how we kind of wanted to use the survey, and, again, developing some of these tools that would help with implementation. We're very intentional about making sure that when we're going to implement something that's going to really impact the work that we're doing, regardless if it's just a 15-minute survey, that it's going to be easy to implement and not create burdens or bottlenecks in our system for our workers. So that's kind of the whole point of this survey implementation team. So if you could turn to the next slide, I believe I have one more slide on there. Thank you. So some of our lessons learned, we found the web automation is very friendly for both youth and staff. We had no issues with entering it into the web. The youth found it to be very user-friendly as well. So we only did the paper piece the one time, and then we moved into just doing it on the web. We did, have some concerns, which is always a concern, I think, with some of the young people that we work with related to self-reporting bias in terms of, we had youth who went through and just marked 5 on every single answer, or, went through it very quickly. So kind of wondering kind of how reliable some of the information may have been, as well as just knowing the youth themselves and some of the way that they rated themselves might not have lined up with how the staff person would have rated themselves, and sort of just kind of what could we learn from that. We really realized that we needed a clear alignment of program activities and language with a protective and promotive factor. So we talk a lot about in our programs about protective and promotive factors, but it just highlighted that sometimes we're not being explicit enough about which activities, what language we're using, and those sorts of things are really part of us building those protective and promotive factors for young people. So we're kind of in the process of trying to kind of align that a little better. And in addition, just kind of the importance of ongoing training and opportunities for learning and reflection for program staff. We always ask them to try out new things, and we're trying to learn from them and do the best things for our young people. And sometimes that can be confusing for certain frontline staff who sort of aren't understanding how to connect all the dots with all of this. So just continuing to have those conversations and to build those pieces into our daily work and the meetings that we're having and that sort of thing. So our next steps really are kind of we are going to administer the survey. So we've administered the survey twice thus far. And what we have found was that we administered it in March and July, and we looked at individual scores over that time. So for the 15 youth that we administered the survey to, and we found that 73%, which 11 out of 15 showed an increase in their total score between March and July. And we also showed that 6 youth reported an increase in their concrete supports and time of need area, which was a big one for us because that's something that we're always talking about as a team. And then 5 youth, even within that, also reported 5 both times, so showing that they really didn't need an area of improvement. But so we had 100% showed an increase or reported 5 both times in that area. So that was just one of the findings that we were sort of found interesting. So our next step really is to sort of figure out, we're going to deliver the survey 2 more times with this pilot ending in January 2020. And review the data, kind of talk about it as the implementation team will talk about it collectively to review the data for the pilot and just kind of figure out how we want to align this more with program development and service delivery. So really the 2 areas that we probably will use this the most is around how do we use the individual scores to inform youth service planning and assessing where youth are and how to support them in developing those service plans and providing services, and then also just the program evaluation piece, sort of are the activities and the services that we're providing supporting youth and building these skills over time and increasing these factors. So we're really excited about it. We're going through a lot of change with the types of assessments that we're doing and wanting to sort of streamline things. And it really feels like I was really happy to hear about the Casey Life Skills because that's another one that we use currently, and to know that that could potentially be something we could substitute with this would be fantastic. So we're really excited about it and excited to continue to learn from it, and appreciated the opportunity to be here today. Thank you.
Thank you very much, Shelly, for all of those great points. And I think just something to help support and the piece about the alignment for program activities and language with the protective and promotive factors. I mean, I just want to underscore the importance of that, and also offer that we have a lot of resources and tools and training that are available in support of that, because, you know, common language, common set of things that workers are having conversations with young people about and are assessing and are incorporating in their work of young people. I think that that makes a huge difference. So thank you for all the points that you've made. Next, we're going to go to Allison. And Allison, you are now unmuted. Allison, can you hear us? Allison, you're unmuted. Let me know if you're not able to hear us. Okay, we're gonna move forward to Nisha, and we will come back to Allison. So no matter how many times we tested this out, folks, I promise you that we did, but something always goes wrong. So Nisha, you are now unmuted.
Good afternoon, everyone. My name is Nisha Jairam, and I'm from the Georgia Division of Family and Children's Services. We are the governing agency for child welfare here in the state of Georgia. And I first want to talk about how we have implemented the Youth Thrive survey. So, Lisa, can you go to the next slide for me, please? Thank you. So, initially, thus far, I think we've had at least 300 youth take our survey who are between the ages of 14 to 18. We've had these youth take the survey at 2 different convenings. We have 2 large convenings for our youth throughout the year. One is called Teens Are For Me, and that's for our youth between the ages of 14 and 18. And they come for about a week, and we stay at a hotel here in Georgia, here in Atlanta. And it's really just a fun time for them to kind of enjoy each other. And also they have some workshops that are aligned with their age group. And then at the end of the year, excuse me, at the end of the school year in May, we have another convening called Celebration of Excellence, and that's for our older youth in care between the ages of 18 and 21. And that's when we really celebrate the older youth who have graduated from high school, graduated from college, attained their GED, and they also have events for them there as well, so workshops, and they also get to meet with each other and have a good time. So during those two different convenings, we held something called an internet cafe, and what we do is we set up our survey in there, and we allow the youth to come in there in between these various sessions, workshops, lunch, whatever. They can come in and they can take their survey. We have two surveys that we do that day. So we do our Youth Thrive survey, and we also do a survey that we do internally. And we do this throughout the week. So if the event is from Thursday through Saturday, we'll hold the internet cafe for all those days. So they have the option to come in any one of those days and take the survey. Once they do come in and take the survey, we offer them a ticket where they can put it into the raffle to win a Visa gift card. And we offer off several gift cards. So it's not just one, we offer off about 5. So that's really exciting for them, and it gives them an incentive to actually want to take the survey. So that's how we end up having these come in and take the survey. Lisa, if you can move to the next slide, I want to talk about the survey registration steps. So we made this flyer for them. We put it at the table when they come in. We have the internet cafe set up, so it's several computers, maybe about 20 computers we have in the room, and we just offer them this listing of directives, how to take the survey, how to register, what to click on, and then also the links at the bottom. So we give that to them so they know exactly how to take the survey and they don't have to ask too many questions, or they can just self-direct. We have a few leads in the room to help them if they do have any questions. And also, they can take the survey here in the room on the computers, or at least if you can go to the next slide, we offer them a flyer that we put up where they can scan the QR code and take the survey on their phone. So once they do that, all they have to do is show us that they finished the survey, and we give them another ticket for taking the survey, which they can enter into the raffle. So Lisa, if you can go back to the first slide where we talk about lessons that we've learned. Yes. So I just wanted to, one more before that one. Thank you. So I want to talk about the uses of the Youth Thrive survey and what we've learned thus far. So two uses that we have for the survey are 1, assessing youth needs, and 2, identifying gaps in service. So when we talk about assessing youth needs, we want to use the survey to pinpoint which protective and promotive factors we really need to work on for that child. Also utilize the information that we get back from the survey to write written transitional living plans for our youth, and also have these conversations with the caregiver and the case manager to really make that service area more robust for that child. And also identifying gaps in service. So identifying gaps in service, this is what we want to do moving forward. We haven't done this yet, but we want to do some type of one-pager for the whole entire agency where we put the aggregate results from the survey, and we also put recommendations for case planning, recommendations for written transitional living plans, and also information on what the protective and promotive factors mean, and information about how to have these more robust conversations with the child, the caregiver, and the case manager. Just a lessons learned sheet for the agency on how to utilize the survey properly and what the functions are of the survey for writing written transitional living plans, and also bolstering up their service array that we currently have in place. So those are the 2 of the main focuses that we utilize for Youth Thrive survey and where we see ourselves moving forward. It's definitely figuring out a way to communicate the findings across the agency. We have over 15,000 kids in care, and we have a very large group of case managers here. We do have an independent living program, which is very big. It covers the entire state of Georgia, and we're trying to figure out ways to implement the Youth Thrive framework into that work so that they can actually utilize the survey results to write written transitional living plans and also have these meetings with the kids. And that's it for me.
Thank you very much, Nisha. That was great. And I think the piece that I want to lift up is about communicating that data, sort of that feedback loop back to the staff, communicating those results in a way that is meaningful to them. I think that is really, really huge. We had some questions that I'm just going to take right now as we support our other presenters. in getting on. One of them is it possible to administer the survey in group setting or individual administration? And as you heard from our presenters, it is possible to do it in both ways. I think Georgia is a great example of doing a group administration and really using those opportunities when there are events and there's a large group of young people that are going to be gathered to take advantage of that, as well as using it for individual administration for those one-on-one meetings with the caseworker so that those conversations can be sparked and it could help inform case planning with that youth and that young adult. I think one thing that is important for both the individual and the group administration is to make sure that there are staff supporting the young people if they are triggered or supporting them on, if they have questions or anything that they would like to process as they're moving through completing the survey. Allison, you are now unmuted. Hi.
Oh my goodness, I'm so excited. Well,
thank you for being patient. I don't know what happened. We did test this out, folks.
Okay.
So that's technology.
We're Multicultural Community Services, and we work with about 100 youth in Central Jersey who are referred by Child Welfare for life skills and aftercare. We work with the New Jersey Office of Adolescent Services, who has been training us in Youth Thrive for years. So as soon as the Youth Thrive survey became available, I got the email and I started using it in November of 2018. We absolutely love it. We have used it with, I think, about 40 youth at this point, although they're not all entered, because we are one of those people that have to do it on paper because we do home visits. We find it very easy to do on paper. We had to set up a tracking system like the others, but it's easy to do on paper and to bring back and just enter it. One little tip for paper, make sure that they answer all the questions or you have to take it back out. Anyway, we're observing, our early observations are that most of the youth are doing well and have many strengths on the Youth Thrive survey. And what they're coming up with is a few specific areas where they need strengthening. So we are taking those, those surveys, and the supervisor is working with the staff, and then the staff to inform case planning, and the staff go back and strategize with the youth on how to strengthen those areas and that need strengthening. We enter into a dialogue with the youth regarding both their strengths and the areas that need strengthening. I think it's interesting that about 2 years ago, following a Youth Thrive training in New Jersey, we had all of our MCS staff begin to carry your Youth Thrive chart of preventive and promotive factors to all of our home visits. And this relates to getting used to using that terminology. The staff and the youth then review the chart of the protective and promotive factors after each session or at the end of each session, and the youth decides which factors he or she addressed during the visit, with discussion with the staff. And then we record this on their contact sheet. That's pretty much all I have to say, and I know you're running late.
That is really great, Allison. I think that's a really wonderful way of incorporating the Youth Thrive framework and using the results from the Youth Thrive survey as part of the ongoing conversations and work with the young people. I really like the idea that the young people decide which factor you know, that they would like to use and get support in. It sounds like really great work.
It helps them to understand what they have achieved and, you know, what they, you know, what skills they are learning and what they have achieved. So that's why we put it down on every record, and they sign it. So.
That's really great. Thank you. We do have one question that is related to what you said, and so the question is that that you trained staff first on Youth Thrive, and then you implemented the survey. How important do you think that is?
Oh my goodness. Well, we didn't train them. I mean, we have ongoing training from the state of New Jersey. So every staff person is trained by the state of New Jersey in Youth Thrive, and so is the supervisor. So I think that's extremely important. You know, in order to use the survey effectively, that we were already very knowledgeable about Youth Thrive. So I can't imagine doing it cold. Is that what you're asking?
Yeah, that's great.
Training?
Thank you. Yes,
yeah.
Thank you very much, Allison. That's great.
Okay, thanks.
Yeah. I mean, I should note that it is possible to administer and use the survey without being trained on the Youth Thrive framework, but as we heard from Allison, that it really supports embedding this into everyday practice with the young people.
Yes, I didn't mean to say that you couldn't do it, but I just think we find it natural and much easier that we do have this framework. Thank you.
Thanks. All right, thank you very much. We are going to try one more time for Nancy. Let's see if we are able to address these audio issues. In the meantime, as we work on that, we do have a couple questions, and maybe Allison, you can answer one of these questions. Is how have you addressed the challenge when there are questions that the youth didn't want to answer? Like, what are the ways that your staff?
No, we didn't have any that they didn't want to answer. We have questions that they skip. So I was just saying just a tip that if you're doing it on paper, make sure that they didn't skip any questions, because then you have to wait until the next time you make a home visit to get the answer. We really haven't had any questions. Youth these days and young adults are so used to doing surveys on Facebook, these self-development surveys, these self-discovery surveys. They're really, they like the survey, and I think that they're excited to do it, and it's one more way for them to learn about themselves. So we really haven't met with any resistance.
So we received a couple questions about what the training, the Youth Thrive training consists of and what's available. So we have a Train the Trainer, and it's about a 3-day training that is available so that staff can be trained up and are able to provide the training. And we've also have some FAQ documents and other tools and resources on our website, and we also will be having a training that's called Youth Thrive for Youth, which is developed by young people for young people, that explains what the protective and promotive factors, for them. So again, it's developed by young people for young people. So all of these resources are available on our website. And information, feel free to reach out to me offline or through our website, and we'll be happy to facilitate the training. All right, and I think we now have Nancy unmuted. Yes?
Yes.
Yay! Go ahead, Nancy.
Hey, how are you guys doing this afternoon? This is Nancy Mason. I'm with the Muskogee Nation Youth Services Program. I'm the director here. We've actually just started implementing the Youth Thrive survey this past summer in July. We'd heard about it when it was launched last fall, and we've just kind of been following it and getting some information. Some things that we plan to do with it and that we've already started. So obviously using it for individual planning with the young people that we serve. And then moving into improving service delivery for our program, and then eventually coming back and looking at that program evaluation and continued development of our services and program. Primarily, we work with young people ages 12 to 24 who are Muskogee Creek citizens. We sometimes serve other tribes also, but that is our primary group of young people that we serve, and that's a blend of all kinds of young people coming from different experiences. So the primary place where we have started with our survey implementation is with the Muskogee Nation Youth Council. That's a service that we've had since almost the beginning of our program. We've only been around since 2015, and so, I'm sorry, 2014, and then the Youth Council came in 2015. And so there's about 40 young people on that Youth Council. We decided to implement with our youngest youth on the Youth Council right now, and so that's middle school and high school students. We've been able to assess about 12 of them at this point. That's just since July, so giving us a little bit of data to look at, and then obviously looking at those individual scores to see how we can help them. We use the Youth Thrive assessment as a part of an overall intake. So we address 6 areas of wellness with the youth, and so the Youth Thrive assessment really complements that whole conversation that we have with the young person around their successes and challenges, and helps us to develop a plan with them. And so that's one way that we're using that. We are also working on developing a mentoring program called Muskogee Mentors, and that will also be a part of that program. To help us with service delivery and planning, but then also to evaluate our outcomes. So hopefully we can continue that in the future. We have just recently received a grant for a cultural arts mentorship, and so we've decided, again, we're going to be using this assessment with every young person that we work with, and so that will be utilized for our cultural arts mentor youth also. And that's going to begin actually at the end of this month. In just a couple of weeks, that will kick off. One other way that we are hoping to use that is not only service development with our program, but other programs that are youth serving agencies within the nation. We've recently talked with the Juvenile Justice Department at the tribe, and they are kind of starting from ground up in developing some services and trying some new things. And so with them, we're actually going to be going out to the Eufaula dormitory, where we have a lot of our young people stay. And so we're going to do the Youth Thrive assessment there to get some data to help them with, like I said, developing some of the services that they want to launch. It will also assist us in looking at things that we need to do with our program over the next year. And we'll also be educating the boarding school about how they can use that data and information to, evaluate students that are coming through their program and looking at long-term outcomes for themselves also. We're also looking at doing just more outreach and connecting with more programs. We have an Indian child welfare program with the tribe, and I definitely think that this would be a great resource for them. And so we're going to be meeting with them and talking with them. Also, I had the opportunity to complete the Youth Thrive training in the spring, and I'll be one of the trainers that can actually deliver that training. And so I hope to be able to do that for our tribal staff. We have lots of youth serving programs, and I believe that this training is something that is helpful for anyone who works with a young person. It touches so many areas. I've worked with young people for a long time, and when I went through the training, I was just really excited that it seemed to be packaged in one great place, like everything you need to know about working with young people kind of thing. And so really excited about being able to deliver that to our tribal agencies and other local agencies that we partner with. So that's kind of the first piece of where we're working at with the assessment, how we've begun to implement that. And then some things that we've learned really kind of at this point come down to the individual piece as well as some service delivery. So just with the 12 assessments that we've completed so far, we're already seeing that about half of them showed a great need in youth resiliency areas, specifically with problem solving and critical thinking. And then also in the cognitive and social emotional competence, and specifically there with anger management and depression. And so it was, you know, kind of good for me to see that, because like I said, the youth that we're assessing now are some of the younger ones. Most of them have been with our program 6 months to a year at the most. And so they're still fairly new as far as receiving some of the services that we provide. And that will help us to do better as far as, you know, addressing some of the specific needs that they have, as well as we do plan to assess all of the young people on the youth council. And so the majority of the ones left now are 18 to 24 and have been with the program 2 to 3 years. And so it'll be good to kind of see where they are right now and what else they might be able to obtain before they age out of our services. So we're excited about that piece. This will also help us with the individual plans that we hope to work with them on. They've already begun some of that, and just looking at their individual needs so that we can hopefully reach out to each of them in more of a mentoring way to our youth council members, also making sure that we're taking care of them as they are, you know, going through their daily lives, because some of them are, you know, out of state for college, and actually one of them showed that he felt lonely a lot with that question that was brought up earlier. And I was actually kind of surprised, because that young person is definitely very connected and resilient, and seems to always kind of be doing well. And so it was a good reminder that even though sometimes young people might look like they're doing well, on the outside, we still have to pay attention to what's really happening with them. And so being able to reach out to them a little bit more. We hope to do reevaluations with all of our youth at 9 months after the initial assessment, so that will give us a little bit of data for outcomes as far as planning for the next year with our program specifically. And I think that's probably the main things that where we are right now. Like I said, we hope to definitely use it for program evaluation and development, more so around that 9-month period, like in looking at that a little bit better to see how we're doing with our services and then what we can do better.
Thank you very much, Nancy. Those are all really, really, really great points, particularly the one about how the survey can be helpful to sort of uncover other things that might be going on for a young person. If you're looking at their responses over time to a particular item, like the great example that you gave, that, you know, they seem like they're connected and they're resilient, yet they still feel lonely. So that's really can help really inform how to best support that young person and uncover something that, you know, you may not be able to see without during further explorations.
Yeah.
And I'm really excited to hear more about the findings once you continue with the assessments and all the work that you're doing, particularly the mentoring program.
Yes,
really great work. Thank you.
Thank you.
All right, so we are going to, we have about 6 minutes, and I apologize for running a little bit late, but right now we're going to open it up for the peer learning session, and so we invite you to ask questions and or share ideas, and the questions can be to any one of the presenters, including CSSP, and or share any ideas that you have that you want maybe some brainstorming on related to implementing the survey or using the survey results. And so you could do that one of 2 ways. You could submit a question, and I will read that out loud, and that may be the better way since we're having such difficulty with the unmuting, although some of the unmuting did work, or you could raise your hand and we will unmute you. So if you could take the time now and you know, ask a question of the presenters and or share an idea, and if you want feedback on a specific idea that you have. So there's still some questions about any costs that's connected to the survey, and I know it's hard to believe that it is available free of charge, but it is. All of the reports, using the data system, administering the survey is available free of charge. And who knows what will happen in the future, but I can guarantee that for the next 5 years, CSSP will continue funding the administrative costs that are associated, with data management and storage and cleanup for the system. So for the next 5 years, and most likely longer, but definitely guarantee for the next 5 years that it will remain free of charge. There are a couple of questions about creating unique identifiers for the young person and being able to, look at the reports in different ways, particularly the pre and post. And so, as I mentioned earlier, the survey itself does not collect any identifying information. And so the young person will need to be supported in creating a unique ID that does not in any way give any information about them. And then it will be up to that organization or that system to have a tracking system to match their unique ID with how the agency or the system identifies them, because that identifier does not go into the system. But it is through that match that you're able to look at the data and conduct a variety of different reports to understand whether or not there's been any change in the protective or promotive factors for the young people. So again, the survey can be used in a variety of different ways. So it can be used as a pre and post to measure the effectiveness of interventions, programs, or services, and it can also be used as an ongoing basis to inform case planning. So that's the great thing about this survey, is that it can be used in a variety of different ways. Keep those questions coming in. And again, if you would like to raise your hand to be unmuted. Okay, so Nancy, I'm going to unmute you. You're unmuted now.
Okay, yeah, there was a couple of the programs, I think Georgia and then the Epworth program, I believe, said they had created documents to share with their young people to better explain the assessment. And I just want to see if they're willing to share those. I think that would be great.
Yeah, that is a great question. I had a very similar thought, so I'm going to unmute them so that they can respond. So Nisha, you are unmuted, and Shelly, you are unmuted.
Hi, this is Shelly with Epworth, and I'm happy to share any of the documents that we've created with whoever would like them. So Lisa, you can just let me know what that would look like, and I'm happy to do that.
Okay, great. Yeah, I think the best thing is if you can email it to us, and then we can send this out along with the slides. We can sort of be the conduit and help connect folks to those resources.
Sure.
Hi, this is
Nisha,
Georgia Division of Family Student Services. We haven't developed a one-pager for the youth yet. We're looking to do that soon. We just developed a one-pager to teach them how to access the survey, make their username and password, and also what to click on when it's time to sign in. But we can share that with Lisa as well.
Okay, thanks, that's great. And just also as a reminder that we have a new tool on our website that helps explain the survey to workers, and that could be helpful as well. So it's at 4:30, and so I just want to say a special thank you to all of our presenters. You shared a lot of great information and a lot of great lessons learned that could help inform others thinking about using the survey. And it's also informing us, and we love feedback. So please reach out to me, and or there is an email that's available on our website as well with any feedback about the survey, and also any additional resources that are needed to support implementation of the survey. We will be continuously updating the user guide, as well as are open to developing additional resources in support of the survey. If you have any other questions or ideas, feel free to reach out to me. And just want to say that following the webinar, you're going to receive a brief evaluation survey. We appreciate your feedback, and also feel free to suggest any other additional topics that you would like us to address for future webinars. Thank you again, everybody. Thank you for bearing through the technical issues with us. This was a great webinar, and hope everybody has a great afternoon.